Third coronavirus case confirmed in the U.S. overnight.
It comes as the CDC investigates more than 60 potential cases of the virus.
Our own Aisha Hasni joins us live with more on the most recent diagnosis. Aisha,
good morning to you guys. Yeah, so this is spreading, and this morning that patient is in isolation at a hospital in Orange County, but the CDC expects even more people to get sick. Patient number 3 is in good condition. We don't know a whole lot more about them, except they did recently travel to Wuhan, China. That's the epicenter of this outbreak. The other 2 confirmed cases are in Washington State and Chicago. And we could see more pop up, as it takes about 2 weeks before symptoms start showing. The CDC is contacting anyone who had close contact with each of these patients. And screenings continue at airports across the country, with workers, at least at San Francisco airport, now required to wear masks. Meantime, the global number of sick nearing 2,000 cases, with 56 dead so far in China. The U.S. is sending a charter flight to bring Americans home. That plane, though, will not be able to get to China until Tuesday at the earliest. And the embassy in Beijing says there may not be enough seats for everyone. Now, several Chinese cities are on lockdown. Authorities rushing to build a 1,000-bed hospital in just 6 days. Now they are building a second, bigger hospital. China's president calling this outbreak a grave situation. The good news here this morning, the CDC says people who've had casual contact with an infected person are still at minimal risk. But guys, the CDC reminding everyone just to keep doing the basics: wash your hands and cover your cough.
All right. Thanks, Aisha.
The scare continues in China as the U.S. State Department orders all Americans in Wuhan to evacuate. This as Chinese officials are confirming at least 41 deaths in the coronavirus outbreak. Ryan Chilcote has the latest.
Yeah, John, the city of Wuhan, home to some 11 million residents in the east of China, remains the epicenter of this crisis. Over the last 24 hours, the central government has sent hundreds of military doctors into that city and is building 2 makeshift hospitals, the first of which they're hoping will be ready to go a week from Monday. That will add about 2,000 beds. There is a lot of talk that people were getting turned away from hospitals as recently as yesterday because they just don't have the capacity to deal with this. The vast majority of the approximately 1,400 people infected globally, a number that has risen from just 40 a week and a half ago, are in Wuhan. Now, you mentioned the State Department ordering all Americans in Wuhan to leave the city. It is also closing the consulate there and flying the American embassy workers home on a private jet to try to limit their exposure to the virus. Meanwhile, China has expanded its lockdown to 16 cities surrounding Wuhan, with a combined population of more than 50 million people. That's greater than that of New York, London, Paris, and Moscow combined. And all trains and planes to Wuhan have been shut now for 3 days. Authorities have also closed many of the big tourist destinations, including Shanghai Disney, Beijing's Forbidden City. And get this, all group tours for domestic and international travel have been halted effective immediately. The Chinese New Year, the Year of the Rat, began today. And it is a time when many of the country's 1.4 billion people are on the move. Earlier today, China's leader, President Xi, called the accelerating spread of the virus a grave situation. And it is now also an international situation. The virus has spread here to Europe, where 3 cases were announced yesterday in France. All 3 infected people came from Wuhan. Potentially good news, though, is that one of the country's most senior epidemiologists says the chances of an epidemic in Europe are extremely weak. One thing to keep in mind, it is not clear whether this crisis is getting worse, whether this virus is spreading more quickly, or whether the reporting, the monitoring and the reporting are just getting better. But clearly it has the attention of a lot of governments right now. John?
Ryan Chilcote.